Hey guys, and welcome back to XO Medical Spa. Happy holidays, happy Thanksgiving, happy Christmas, and all the other things that you celebrate as well. So I've been away for a bit. I'm doing some traveling. I finally recovered from my Achilles rupture. So I'm finally out of the boot, finally out of the crutches. So if you guys have seen me in practice, you've seen my full progression. But I'm doing well, and thank you for all the well wishes. This week, I want to keep it easy. I'm just going to do some Q&A. I had some questions during the week, had some questions online, and some instances where some patients ran into concerns where I feel like a lot of other people have run into these concerns as well. So let's bring those up and then discuss it when we get back. First question I had revolves around Botox, Dysport, or any other neurotoxin that you can think of. But this is one of my longtime clients. I think I've been seeing her for 3 or 4 years. But I hadn't seen her for over a year. When I saw her name pop up on my list, I'm like, oh wow, I'd like to see her again. So she came in and she told me the rationale. She's like, hey, I felt like I was just doing too much and I think I was building up a tolerance to it. So I took about a year break from it. I'm like, oh, no big deal. Actually, it was like a year and a half break from it. So we did a normal Dysport based on her movement and then also based on what I did historically. So I just wanted to start off at the same thing. I got an email 2 months later. Yeah, 2 months later, she's like, hey, it's 2 months later, it's already worn off. I thought usually this lasts about 3 or 4 months. And then in her mind, she says, yeah, I took a break because I felt like I was building up a tolerance. Granted, this may be the case. You did build up the tolerance and you might have to bring it back or take a break from this medication. However, what I think more than likely to happen, and which happens to a lot of people, especially in men, is if you're consistent with Botox and Dysport, what happens is you're atrophying the muscle. You can think of this as another way. Every time you do Dysport and Botox, if you maintain it, you're always weakening the muscle. You never let the muscle recuperate. Remember, yes, we're treating the wrinkles. Click the card in the description where we talk about Botox and Dysport. Yes, we're treating wrinkles, but what we're actually doing is we're treating the muscles that cause the wrinkles. So if you can imagine, every time I frown, I create that wrinkle. If I take a year and a half break from it, what I'm doing is I'm working this muscle out every single day. What happens when we work on a muscle? It gets bigger and stronger. We dose Botox and Dysport based on how strong we think that muscle is. So if you're never able to fully work out that muscle always stays weak and we can keep the dosing low. But if you take a break, essentially what you're doing is you're working out that muscle for the next year and a half, and it's just getting stronger and stronger. Men typically need stronger doses because we typically have stronger muscles. We have more muscle mass. Our faces have stronger muscle mass, so we require a higher dose. Take that break, recuperate from that muscle, gain all that muscle mass back, and now we're starting over again. So tolerance does play a role, but when it comes to tolerance, we have other ways to manipulate the medication. We can change medications, we can up the dose, or we can take a small break, but take a year and a half break, that's likely what happened. Second question I encountered, another patient came in, not my patient, but a new patient that came to me. She's like, hey, I've done under eye fillers multitude of times, but this last time I just bruised like crazy. And then I also became very, very swollen. So long, extensive history. This patient has done eye fillers probably every year and a half. This last go around, I asked the same questions. Change the product? No. Change the provider? No. Change the technique? No. When it comes to needles to the face, and I know I'm very blunt when I say that stuff, I'm putting a needle to the face. Anything can happen. Bruising and swelling. Although we never want it, it has to be a concern. So if I do fillers, I do even just the simplest of Dysport, I tell anyone 2 weeks outside of any special occasions because I don't want to bruise you, I don't want to make you swell, but it is a possibility, or it is a potential. So you have to give yourself that buffer. So in this instance, same provider, same treatment, same every time, but maybe they hit something, maybe the bruising was just got worse, maybe the client had some alcohol because it's the holidays, who knows? But always give yourself that buffer and always know that just because you get a bruise or a swell doesn't mean the provider did anything wrong. Doesn't necessarily mean the filler did anything wrong. It just could be a random occurrence. As long as there's no long-term issues, then you're good to go. Now, in this case, what do I think happened? Likely it was a needle injection because this injector, I asked them if they did needles or cannula. This patient, from their recollection, did needles. So when you poke a patient a lot, especially in this area, two things happen. This is a very vascular area. If you're very light skinned, you'll see it. If you pull your eyes down, you'll see a lot of vessels in that area. So if you're poking many times in this area, you increase your risk of hitting a vessel, and you're increasing the risk of getting a bruise. The other part of this is a very water fluid area. If you poke this area, you're creating these tiny little holes, and these tiny little holes allow fluid to escape. So if you allow fluid to escape, your eyes will puff. If you can imagine, you're a late night out, you're drinking, you have a big salty meal, you watch a rom-com and you cry the night before, the first place to swell is this area. You travel, which we'll talk about the third question. If you travel, you get swollen because of altitude change. You go to humidity or water change, your eyes are the first place to swell and puff. So by injecting needles into this area, by injecting fillers into this area, you are a high risk of bruising because of the vascularity. You're a high risk of swelling just because of the nature of the eyes. And if you're using needles, you're poking in that area. So how do we mitigate this in the future if we need to do it? To mitigate this, I personally use cannulas. Most of my injections are cannulas anyways, and you guys have heard me speak about cannulas. With cannula, rather than poking a couple times down under the eyes, I can poke you once, somewhere where I can reach the eye, and with that one insertion point, and you can see the video here, I'll put a little video up here of me doing cannula injection, I can fill this entire area with one poke. Also, limiting the pokes helps, but also with a cannula, it's blunt. It's not a needle. So if I happen to nudge up against a vessel, the cannula will likely just push that vessel aside and reduce any bruising and swelling. And the last question, which is very similar to the second question, is, let me read it here. I've recently went on a trip and my eyes got swollen. I haven't done fillers there in over a year. So this patient hasn't done under eye filler in over a year. So in their mind, they're like, well, technically I don't have any fillers there. And then also, I've never had this situation where my eyes puffed up so much. This is a two-parter, maybe a three-parter as well. People always assume when we give a timeline with lip fillers every 6 to 12 months, mouth fillers, 18 months, 2 years, cheek fillers, 18 months, 2 years, is people think as soon as that date ends, that filler is gone. If you look up research where they've done MRIs, 5 years down the line, there's still residual filler in that area. So when it comes to eyes, mouth fillers anywhere, likely your fillers are still there, even though it's so remote years ago. There might not be enough for you to see it, because why? One part, the fillers have dissolved over time, so there might be a minimal amount there. The second part is you've aged over time. You are a year older, you're 2 years older, you're 3 years older. So your age is going this way and your filler is going this way. So yes, they're at a maximal point, but eventually you're this much older and your fillers have dissolved this much more. Now in this instance, what I asked the patient where they go. So they went to, sorry, I've had some allergies lately. They went to Miami. So why did a plane flight? Why did Miami potentially cause swelling? So what happened was, any remnant of filler that you have there is going to amplify what would normally happen to you. Our eyes are the first place to swell, as I spoke of previously. You take fillers is a hydrophilic product. It pulls in moisture and water. So flying, elevation, Miami, humidity, and likely they were partying, drinking, eating salty foods down there in MIA. Likely all those things contributed to a puffy eye. So when he came back and he saw me, again, not my patient, it was another provider's patient, and she just didn't happen to be around, same practice. But he came in to see me and he's like, hey, what's going on? I get an under eye filler last year. I've never had this issue before. And we combined all things together, because by the time he got back, he's like, well, it's not as bad as when it was when I was traveling, so I don't know if I want to dissolve it. So I gave him some options. I said, hey, this is what's going on. You flew, we got swollen, elevation change. You went to Miami, it's humidity. Down to San Diego, we're more of a dry climate. So humidity caused that amplification of the swelling. Lastly, did you party? What did you eat? Yeah, went out to party, I drank, also ate a bunch of salty Caribbean food as well. All those things amplify it. So when he flew back, he was under the impression that he would probably have to dissolve or do something to mitigate or calm down the situation. By the time he got back to the dry climate of San Diego, he'd been in town with us for about a week or two, most of it went away. So I gave him the option. I'm like, hey, whenever this happens, likely it's going to happen again. But if we dissolve the filler, what's going to happen is that normal climate, that normal environment that he's in San Diego, if you dissolve that filler, you are now going to have that tear trough. Granted, if you go fly and you go to Miami and you puff up again, not because of the filler, just by nature, you're gonna swell again. Your eyes are gonna look good. So when you fill the under eyes, I always warn people, fill the under eyes to 70, 80, maybe 90% correction. And we're also building up to that point. I never wanna correct you to perfection at that very first visit because we have to give this fluctuation. If I fill you to 100% and we live in a dry environment down here in Southern California, and you fly to a humid environment, now you're gonna have 110, 120% correction, meaning you're gonna have a puffy eye, or vice versa. This isn't necessarily a big issue, but let's just say you live in Texas, you live in the southern part of America where it's more humid, and you have a perfectly filled eye. You go to a dry environment, all of a sudden you have sunken eye because you've lost that moisture, that normal environment that you lived in. So that's why we have to give that leeway when we come to under eye fillers. That's it, guys. That's a wrap for the Q&A this week. I wanted to keep it simple. Some of the questions I ran into, and probably some of the questions that you've thought about yourself if you've done fillers in the past, or even Dysport or Botox in the past. So I just want to say happy holidays. I hope everyone's enjoying the family time, and I hope to see you guys in 2023. But I'll probably get one more video up before the holidays, okay? I'll see you guys soon. Oh, and thank you. Thank you to everyone who took advantage of our Black Friday. It was a tremendous sale. We do it once a year, and we do it really just as an appreciation to you guys. So everyone who took advantage of it, good job. I know you guys put a lot of work on my front desk, Amber, a lot of work on my media team, Cheyenne, but they put in the work as well. I just want to say thank you and happy holidays again. I'll see you guys soon. Bye.